Our guest speaker is Dr. Asanka Wijesinghe. He's a research fellow at the Institute of Policy Studies of Sri Lanka with research interest in international trade, regional integration, and industrial policy. Asanka holds PhD in agriculture, environmental and development economics from the Ohio State University. His latest research focused on the effect of trade policy on household food security and the impact of COVID-19 on the women workers in the ready-made garment industry of Sri Lanka. Over to you.
Thank you, Sana, for the introduction. I'm Asanka Wijesinghe. This project is on the female workers in the ready-made garment industry. The issue is this garment industry dominates Sri Lanka's economy when it comes to GDP and also the exports. About 40%, in some years 50% of export revenue comes from the ready-made garment industry. And this is the major industry that provides employment to low and moderate medium skilled women. About 70% of the workforce in this industry is women. When the pandemic came, Sri Lanka was heading for a balance of payment crisis too. So these two crises overlapped. It was necessary for the economy to function this vital industry. And the COVID-19 response was mainly about minimizing the human loss and also maintaining the possible economic activity. So in that case, considerations like, for example, whether female workers were disproportionately affected were ignored. And the underlying industry and workforce specific issues increase female workers' vulnerability. For example, almost all of these jobs have physical nature. It was necessary for them to be present on the work floor. Work from home option was not available for them. And about 80% of these workers are from rural areas. They migrated into economic processing zones, export processing zones. The accommodations were not good for quarantine and to face this pandemic. And lack of formal unemployment benefits further aggravated their vulnerability. You can see due to the economic importance, as the industry functions even amid the pandemic, the employment contraction swiftly recovered by around 2021. So it was a good story for female workers when it comes to the economy, but still it implies that these workers had to face this spreading virus while working. You can see the food industry continuously collapsed the employment when it comes to 2021, but export-oriented garment industry recovered fast. So we have several objectives. One major objective is to find out the impact on the female workers in different variables, health and economic variables, and to gauge the effectiveness of the pandemic responses at different levels. Government has a set of policies, and also industries took some initiatives to minimize the impact, because it was very important for them profit and the labor productivity, labor health were related. Finally, this is the major objective, to design a pandemic response protocol to mitigate the disproportionate economic and health impact on women workers, especially considering the structural issues as the structural issues I mentioned. So we want to make sure that these change policies should be in place to face a future pandemic. This is the objective of this research. we followed various approaches actually, because each objective had different pieces of research. So I'm just explaining what we did in objective 2. So we wanted to ask what was the health and economic impact of the pandemic on ready-made garment industry workers. We used the qualitative structured questionnaire. Was the impact disproportionate to women? We tried econometric estimates, but the thing is that averages always mask the existing heterogeneities. Then what the structural characteristic in the industry make women workers more vulnerable? We did the series of focus group discussions, KIAs, and questionnaire. Initial research work were focused on identifying the evolution of the pandemic. There were various phases, for example. In each phase, the issues faced by the women workers were pretty different. For example, in the first phase, government was learning how to respond to this. They just shut down the entire country, so these economic processing zones did not have enough transportation means for these workers to go home. So they were stranded there. So this timeline mapping helped us to identify the evolution of the pandemic, identify the critical phases, and identify the affected variables. So we used those variables to produce the questionnaire to gather more information. Key findings are econometric estimates show that there was no disproportionate impact because we had to rely on the available secondary data, like labor force survey data. However, the averages mask important heterogeneities. For example, even within the women workers, there were different groups, like temporary people with temporary work contract, formal workers, internal migrants, and also people who come from their own homes. And when we did this using the various data sources, we could find that there were disproportionate income losses, disproportionate unemployment to women, and various hardships in the first phase, especially, for example, no access to health care, no adequate food in quarantine centers, and when they were forced quarantine in their own home. And quarantine measures were pretty drastic. They were not considering female-specific requirements. And the issue is the accommodation issue. They increased the vulnerability to the pandemic. When it comes to the policy response, we did a series of KIAs and tried to find out whether the measures were gender sensitive. We found that female representatives, sometimes they were there, but active involvement was lacking. For example, in the ration pack provided to the women workers, some of the items they wanted were lacking. And recognition and acceptance of gender issues, as I said, was not that good. The idea was to maintain the economy and save human life. This is the expected outcomes of this research. So we have completed the analytical part. Now we need solutions. For income loss, we suggest ETF-based unemployment benefit. ETF is like contributory fund. Workers contribute to this from their own fund. So there are legislative mechanisms for them to use as an unemployment benefit. We are trying to put that in the policies and improve accommodation and introduce legal rental agreement with decent accommodation, change guidelines in gender-sensitive manner. So we are working on them. Our core PI is, decision maker core PI is the National Planning Department of Sri Lanka. They have the institutional capacity to push forward these policies. Expected knowledge translation in the coming period is mainly, as I said, to revise this existing pandemic response protocol and introduction of many minimum standard for rental places, especially boarding places, and formal unemployment benefit as a safety net. So we are identifying the focal points, existing government technical committee to push forward this policy. Thank you very much.
So what changes are needed to strengthen the role of knowledge translation and policy making at the individual, organizational, and institutional level?
One is actually our capacity building. So I was trained as an applied economist. So our goal was always to publish, get citations. We did not think beyond that. Once we got this grant, actually our research director, she was working with this paper. She had the exposure. She told me, maybe you need to think about how knowledge should be translated. I was like, knowledge what? It was like... So this is like a very abstract term. Still, APHRC helped us a lot into regional, to the first workshop and the second regional workshop to understand this concept actually. What is that, for example, for people from the economics field. And it is also ideal if we can learn from best cases, like, okay, in this particular case, knowledge was translated like this, and it was very effective. So then we can mimic that experience. In trade literature, we have seen that, for example, okay, Rwanda has a best national single window. So, okay, we can then tell politicians, you can look into that and try to mimic it like that. Maybe a dedicated website or something like that is a great thing, highlighting the success stories. In knowledge translation. And also politicians understand when we say it with numbers, like this much of workers will be affected. These are votes. They are always caring about the votes. And they want to see when we show a measure, okay, do this, then they ask, what about funding? That's why when we are saying you might need to think about unemployment benefit, we try to show them funding source. Okay, you have employment benefits already. We have this fund. You don't need to tax the taxpayers anymore. Like that, these are the areas I think in this knowledge translation it should be doable for the politicians to get these things done. Yeah, thank you.